Yo, 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 yo. Hey guys, welcome back to another awesome edition of the Best Practices Show podcast. Happy Friday, everybody. Hope your week was a great one. And on Fridays, our job around here every Friday is to keep you at the top of your clinical edge. Make you think a little bit better with insights from the top experts in the field. And one of the things that comes up in great dental practices everywhere are patients who get stuck in Perio Purgatory. Have you ever had a patient that you care about a lot and they're just stuck there? Well, how do we get them unstuck? Well, I thought I would bring on a good friend of mine, Rachel Wall, who's brilliant, to help us understand what that even means and how to get patients unstuck when they're in Perio Purgatory. So please listen up. I hope you guys enjoy it, and we'll see you soon. Hey guys, welcome back to the Best Practices Show podcast. You know the jam. I say that every day, but it's so much fun. I get the coolest people in all of dentistry to present some big problems and some solutions and some new thinking for you so you can create a better practice and a better life. And I have a dear friend of mine who's been a recurring regular guest. She is like the expert on all things hygiene, leadership, perio, you name it. And she's a rock star speaker. So if you haven't had her speak to your study club, I don't know what you're thinking because she's the best. Rachel Wall is on today. We're going to be talking about a hot subject, which is what do you do when patients fall into Perio Purgatory? So thanks for being back, my friend.
Oh, always enjoy this. Always, always. Yes, thank you.
Yeah. Now, I want to start here. Even though you've been on many times, I have a lot of people that are listening that are younger. They might not know who you are. I want people to know who you are. Who's Rachel Wall? What do you do?
Yeah, so I am a hygienist of 34 years in May, which is kind of crazy. And I started and I own and run Inspired Hygiene. And we are a coaching, consulting, training firm that has a really specialty niche in that we help develop and elevate systems, services, and profitability in the hygiene department. And we work with general practices, periodontal practices, pros practices, any dental practice that has hygienists. We love to work with them and just help them take the foundation they've already built and just refine it. And one of the neat byproducts is obviously always we talk first about patient outcomes and patient care first, which we're going to be focusing on today. Next, we want to make sure the hygienists feel really engaged and excited about what they're doing, really get re-energized about hygiene, feel really clear on the standards of care in the practice across all the hygienists in the team. And then all of that translates to elevated profitability in that hygiene department for the practice. So that's what we do.
Yeah. And if you haven't checked it out, I'm going to encourage you to check it out. So you can go down to the show notes. You're going to see links right to what Rachel does. Make sure you follow her and look into it because she's awesome. And I'm just so excited to have you back. And now we've always had something in common, even though you've been like my smart sister. It's like now we have daughters that are, your daughter's going to be going to Chapel Hill. Woo! So
Tar Heels.
Tar Heels. So
so we're Tar Heel parents together now, which is awesome.
It is awesome and expensive at times, a lot of times. So it's all good. But
mostly for you because you're out of state.
That's true.
So, yeah.
It is ridiculous what people out of state have to pay compared to in-state, but that's the way it goes.
It is.
Now, today, you and I were chatting before we hit the go button. There's a phenomenon that you're running into. You just came back from a great practice and you're like, wait a minute, what? Can you explain? Let's go really high altitude. What is this Perio Purgatory and like, how does it happen? Like, talk about the why.
Yeah. So how it happens is, so many different layers to this. And we've been seeing this for 20 years. And it's really surprising that we still see this even today. And what it is it's when there are dental practices that have invested in, the doctor has invested big time in their clinical education. They've invested in developing core values and, really developing a good culture within the practice. They've invested in a new space and technology and all of these things to make sure their practice is operating and delivering optimal care. And yet, a lot of times, their perio protocols get ignored, or they just don't know where to start, or they're not even aware of how far behind the curve their perio diagnosis and treatment systems are. And so what happens is the patients unknowingly are stuck in this perio purgatory. So they're not, to the hygienist and the dentist in the practice, maybe these patients aren't really healthy. We know we're seeing some bleeding there, and there's some things happening. A lot of times dental teams will call it the gray area. There's a patient in the gray area, where we're calling it perio purgatory, where they're not healthy, but they're not coming in with, vertical bone loss that is extensive, and they're not losing teeth to periodontal disease. They're somewhere in between. And unless a team has a really clear and defined and communicated, and I would say written, standard of care around that threshold from when we move them to from a adult prophy or even perio maintenance back into active therapy, unless that is really, really clear, a lot of times patients get stuck in that perio purgatory. And we see it in general practices, we see it in periodontal practices even, and it is a huge opportunity to elevate care for patients, help them get healthy. And I would say the next layer of the why to really address this, Kirk, is because we now know that this is active inflammation, and inflammation is a risk factor for type 2 diabetes, heart disease, some types of cancer, stroke. There's just so many different connections with inflammation. And so, that's what we're still seeing 20 years later. And that's one of the primary things that we help teams really move through, is going from patients in that perio purgatory to now all of a sudden, the doctor's seeing patients and doing a crown prep and they're not bleeding.
Yeah.
And now these patients are in perio maintenance and they're actually healthy. And so it ultimately makes the clinician's jobs easier and the patients healthier.
Oh my gosh, I have so many thoughts. Now, you were the one that introduced me to Beat the Heart Attack Gene, and then you sent me the other. So, like, if you're listening to this, this is like a great place to start. You don't even need to be in dentistry.
Yeah, that's right.
You. And the reason I say that is a lot of times people just need to be exposed to this research, because I think you can speak to this better than anybody. We used to say, it's almost 30 years I've been doing this. It could be, there's a chance it could be. Now there's so much incredible research.
Yeah.
Can you just talk about that just for a second, and then we'll weave that into what we're talking about?
Yeah. So there is an incredible body of research now that is, in my opinion, and based on the research, that it is very clear that there is a connection between periodontal disease and many, many other health conditions that can be fatal. Heart attack can be fatal. Type 2 diabetes can result in, a lot of fatal complications. And so in my mind, there's no question that there is a connection between periodontal disease and inflammation and increased risk for heart attack, type 2 diabetes, Alzheimer's, all of these number of things.
Right.
And there are some naysayers out there, right? There are some naysayers out there that don't believe that. And I would say there are different levels of connection, right? And there are some, I would say with Behrendt, there's some research that they've done, and they feel very confident that there is some causality there with periodontal disease and cardiovascular disease. And Kirk mentioned Beat the Heart Attack Gene was written by Dr. Brad Bale and Dr. Amy Doneen. And then their second book is Healthy Heart, Healthy Brain, I feel is the name of that. And that one to me was an easier read, just as impactful. But there's a whole chapter 10, I think it is, in that book that's all about oral health. And it's not just periodontal disease. It's also asymptomatic periodontal abscesses, right? This is infection in the oral cavity that is very, by the way, very close to the brain, right? Like if you have a periapical abscess on a maxillary tooth, it's really close to the sinuses. It's really close to the brain, and that's not something that we want to take lightly or mess around with. And there's a lot of also diagnostic protocols that teams should have in place for that as well. Like, how often are you doing a CBCT scan? How often are you doing a panoramic scan so you can see things like that? Because sometimes they're not symptomatic and patients don't know. And so to be able to give our patients that information and have that diagnostic information there.
Yeah, I love this. I have so many. Can I ask you about? We're going to go back to when your patients fall into Perio Purgatory. What's your hypothesis? Because like this theory is not new, and I'm just going to speak for it. Like I've taken a lot of education. I've done all this. Like how could we fall into this trap? Is it just we just got too busy? I don't revisit the philosophy. Is it changing of team members? Is like what's your hypothesis on why our patients get stuck in purgatory?
Okay, so we'll move through a few. So I would say hypothesis number one, especially in the last few years, is team turnover. And here's the deal. Dental practices, along with a lot of other businesses and healthcare in general, have been in a whirlwind of changes in the last 5 years, not only from kind of the fallout of the pandemic, which I think we're still I think we're still facing that, and it's really our industry as a whole is still experiencing some of those aftershocks. And not only that, but then at the same exact time, we've had this huge influx of technology into dentistry, and so everybody's trying to kind of figure out what should I be implementing and how should I be implementing that, and should I be 3D printing temps? So I mean, you can only implement so much in business, and a dental practice is a business, and it's a business that while they're implementing changes and integrating new team members and adding new technology, they're still seeing patients every day. It's not like their full-time job is technology integration.
Right.
They're doing all of that while at the same time taking care of patients, and every patient that walks in the door is unique and presents with a different set of, combination of medical risk factors and dental history. It's like every single patient is a puzzle. And so they're solving for that all day long. So one of it is just you can't address everything all at one time.
Yeah. And then can you speak to this too? It's not like patients, I'm guessing, are coming in and they're healthier. Do you know what I mean? Like
No.
is disease going away, or is it
No.
becoming more weird? I just saw recent statistics on, so many things that are increasing like exponentially every year. I have to believe that the same thing is happening in our oral health system.
Well, it is, because as our patients are getting sicker, they have more things that are taxing their immune system. And so it takes two things for an infection to occur: a bacteria, a pathogen, and a susceptible host. So if all of a sudden more people are developing type 2 diabetes, that means we have more susceptible hosts. We have more patients that are not able to, their body's not able to resist the attack of these periodontal pathogens. And while there is also this kind of quest and this trend of health and wellness, right? There's a percentage of patients and people in general in the US that are taking control of their overall health, right? And kind of adopting some of these. There's still a population that, diabetes is increasing dramatically. And so in I think both of those books, the Beat the Heart Attack Gene and the Healthy Heart, Healthy Brain, it's on Dr. Amy Doneen's website as well, is these red flag risk factors. So this is something that we work with all of our clients on, so that they're recognizing what are these risk factors for heart attack, stroke, type 2 diabetes, just even some of them that they're seeing on patients' medical history. And they're things like, I just watched a video, we'll get the link in the show notes for this, that Amy Doneen posted about these risk factors, and one of them is migraines.
Really?
Who thought migraine headaches is a risk factor for cardiovascular disease?
That would make sense. Tell me a little bit more.
So I've got to do more research on this.
Yeah.
But somebody, one of a practice I was with last week, they said, yeah, we just had a patient cancel because they had a migraine.
Yeah.
Okay, we need to note that. That needs to go in their medical history if it wasn't already. So as clinicians and really even any team members, we don't just teach team members, protocols and help them put in place protocols. We're teaching them critical thinking.
Yeah.
When we're hearing these things from patients, it's not just, oh, they called in, they had a migraine. It's like, that should be a huge red flag for our team. Why did they cancel? Because their, rheumatoid arthritis is flared up. Like, we need to know these things because it affects their oral health, and it creates a hugely strong why for why we need to get these patients out of Perio Purgatory and into treatment, or refer them, whatever you feel like is appropriate, so that inflammation can be eliminated.
So well said. So let's say I'm a dentist listening to this, Rachel. Okay, so I'm going to go to my practice. I'm probably driving to work. I'm like, oh my gosh, I've got Mrs. Finelli. She's been here for 20 years. We talked about this a little bit. Sometimes we identify this and then we go to work and then you go, we're not getting anywhere. Like, what? Help me through that. Like, what are your thoughts?
So a lot of times we're not getting anywhere. We've created an awareness, right? Maybe somebody's listening to the podcast or they've been to a course or something like that. But in a practice, again, we're dealing with all these people every day. There are often obstacles that are keeping us from implementing this. I'll tell you a really common one right now is the lack of sufficient capacity on the hygiene schedule.
Totally agree.
So you can see all this periodontal disease and you're like, oh my gosh, we've got to come up with a protocol and a way to address this. But if there's nowhere to put it on the schedule, what are we going to do? So the hygienists are looking at it and they're like, this patient's bleeding. But even if I recommended scaling, root planing, periodontal therapy, I don't have anywhere to put them for 6 months. There are practices that are booking out 6 and 7, 8 months. I'm sure your team is seeing this too.
100%.
And all of us collectively are helping practices come up with creative ways to overcome that. And there's a million different ways to address that. Some are easy, some are not easy, but some are necessary. But if that's happening, then very often the hygienist just kind of puts his or her head down and says, I'm going to do the best I can today, and whatever procedure they're in, usually it's an adult prophy, and we'll check them the next time they come and see if they're any better. So they're often doing a level of periodontal therapy that they can in that situation, which is typically not enough because they don't have enough time. So they don't have the time to talk to the patient and really address what's happening and kind of draw a line in the sand to say, you have periodontal disease. And so now we have to treat this accordingly and treat you going forward accordingly, knowing that they're not having the opportunity to do that. So that is one of the very common obstacles to getting patients out of Perio Purgatory is they don't have time on the schedule to get the patients in.
Okay. And can I just go there? Because you're my friend and the network's not going to censor us because there isn't one.
Okay.
You mentioned the capacity, which includes time. Like you need time to talk to patients. I get this one all the time. I just got to ask you. So I have hygienists that'll come to me. They're often not clients of ours, but they're like, can you believe this? My dentist wants us to go from an hour to 45 minutes or even 30 minutes. I get that one too. Like I don't know how you could do anything in that time, nor discuss oral health, like for the most part. Do you have a philosophy just on time?
I do have a philosophy. So in my experience as a hygienist and also as a coach is without an assistant, when you drop down to 45 minutes or less, the hygiene department is going to be more on the prophy hamster wheel. So one of the first things that drops is diagnosis. And that's just not hygiene diagnosis, that's restorative diagnosis as well. So think about this in a long-term plan, right? Don't you want, the hygiene department really is the engine behind recurring patient care and diagnosis into the doctor's schedule. If you take out 15 minutes, it's going to be 15 minutes of diagnostic and patient education time. It's not going to be 15 minutes of scaling time. because the hygienists have a certain standard that they're not willing to compromise from a scaling standpoint, right? They're like, this patient's paying for a prophy, they're going to get a prophy. Now, a lot of times hygienists are doing more than a prophy, and that's another conversation. But in my experience, if you're cutting that time down, that's what's going to happen is patient relationship, education, and hygiene and doctor services are going to be reduced because there's not time to diagnose that in those hygiene appointments. Now, the alternate is if that hygienist is working with a dental assistant, then, and we are advocates of assisted hygiene. That's not the only way to work, obviously, but that is one way, and it can be done very well when a hygienist and an assistant work together to serve that patient.
Yeah. Okay, cool. I really appreciate I wanted to know your opinion. I don't think I've ever asked you that on the podcast, but
Yeah.
And let's go back to obstacles. You mentioned like one of the challenges that creates this, and I do want to talk about countermeasures, like what will we do if a dentist realizes his patient is the capacity, anything else that gets in the way that creates this situation with patients that they're stuck in purgatory?
Yeah, just mindset in general of, how am I going to tell my patients they have periodontal disease when I've been seeing them for 7 years, and they trust me. And it's like, that's why you have to tell them, is because they trust you, right? And it is our duty to do that. And so we give teams very specific, kind of methods to bring the patient alongside them in the diagnosis, right? You've got to tell the patient what you're doing. You can't wait till the dentist comes in at the end of the appointment and then drop the bomb on them. It's really, it must be a collaborative approach to diagnosis with the patient being one of the collaborators, them being brought into the conversation early on by letting them know, look, we're going to be evaluating your gums and the bone that supports your teeth. And, healthy gums don't bleed. So if you hear me call out a lot of areas of bleeding, something's going on and we'll talk about it.
Yeah.
Yeah.
So I could keep you on for like 2 hours in this one. You agree verbal skills matter, right? In hygiene, especially.
Yes.
Are you
100%.
Give us a state of the union. When you go in, you meet a lot of amazing hygienists. I mean, and how much care has been put into constantly nurturing the calibration of like how we communicate in verbal skills? Are you blown away that a lot of practices don't hold that value high? Is it like how?
Correct. They don't. And the other thing is, one team member could be calling a procedure one thing, and another team member can be calling it something else, and they wonder why patients get confused.
Yeah.
Or the big one is they call a periodontal therapy a deep cleaning. Well, patient thinks, especially if you're a lot of your patients have insurance in your practice, they think, well, I get 2 free cleanings a year, so why is this $1,200? I'm very confused.
Yeah.
Right? So we don't recommend using the term deep cleaning at all.
If you ever said that to me, I would be like, what the hell kind of cleaning have you been doing in the past 7 years?
Good point.
Now you're going to do a deep cleaning?
Kind of been doing superficial. We're not really serious about it. Yeah.
I just kind of touch them up a little bit,
Right.
so.
Yeah. So using terms like periodontal therapy or gum therapy, right? Yeah. We're addressing a disease. This is a therapeutic procedure. And really the other piece too with that, and then we'll talk about one other obstacle, is really making it matter to the patient. So we have a framework that we teach about how to present periodontal therapy, and it applies to restorative therapy as well. And one piece of it is, I'm concerned. Why am I concerned about this patient's condition and them specifically? And it's not, I'm concerned because you're getting ready to have crowns and it's going to be really hard for the doctor to prep these teeth if you're bleeding. No,
Right.
It's not about me. I'm concerned because I know you've shared with me that you're really serious about controlling your diabetes. And this is going to make it harder. But when we treat this disease, it's going to make it easier for you to control your diabetes. Or maybe they're healthy and they don't have any risk factors. I'm really concerned because I know you've really been serious about taking care of yourself.
Yeah.
And you have an active infection. And that's going to affect it's going to you're doing all these other things to reduce your risk for diabetes, and yet you have this inflammation. And so, let's work together to get that under control.
Yeah.
So really making it specific to the patient
Right.
is huge.
And then just tell me your experience on verbal skills. You can't, even when you guys go in, you can't just say, here are the verbal skills. Like, you got to practice this. You got to learn.
It.
You got to learn
Yes.
from the other hygienists. You got, like, it's not a one thing type deal, right?
Yep. You have to practice it. So when we're there coaching, we do in-office coaching with teams. They practice. They pull out patients from the next week that they expect they're going to be presenting to. We look through the case together. They're practicing all of that so that when they sit down with that patient, it's not the first time they've said it. And they can have a little more confidence. And then the second time they say it to a patient, they're going to be that much more confident. And then the 10th time, imagine how confident they'll be then.
Yeah. I mean,
and
even
all of that translates into patients feeling more comfortable accepting the treatment that you're recommending.
Yeah. And even when Sarah, my wife, tells me something, she knows she's got to tell me anything like 7 times before I even start to understand it. So you mentioned there's one more obstacle.
I would say the other obstacle, which is somewhat related to just the mindset of recognizing that there's disease that needs to be treated, is this okay, I'm going to call it bleeding blindness. I don't know.
I like that. Tell us what that is. What is it?
It's when we've been seeing a patient for a long time and their bleeding, their inflammation isn't getting any worse, but it's not getting any better. So a lot of times that gets defined as stable, but really what it is chronic inflammation.
So true.
So bleeding is our indicator of active disease. And if our patients come in every time and they're bleeding every time, even if it's the same areas that they're bleeding, we're allowing them to have that chronic inflammation, which is not healthy. So just having that we develop that blindness to inflammation or bleeding or, that there's a problem there. But because we see it so often, it just becomes normal. We've normalized it. You and I were talking about that, in the pre-show, but we've normalized it for that patient. This is normal for them. Just because it's normal doesn't mean it's healthy.
Right. That is so true. And it could be for a lot of factors. It could be a patient they haven't made any changes. There's too much other bleeding. I've got other patients that have more perio. I don't have enough time.
That's true.
Yeah.
And sometimes you do have to triage, right? You have to set different thresholds for when you're going to move patients into therapy based on patient flow and availability and that kind of thing. It's kind of like you're in the emergency room, right? And you've got the gunshot wound and you've got somebody with the flu and you've got someone having a heart attack. Sometimes you have to prioritize, right, where you're going to get these patients in, knowing that, hey, maybe we need to hire another nurse so we can see all 3 of these patients instead of just, number 1.
Yeah.
So, yeah.
I love this. This is a huge challenge I can see in dentistry, and you get to see it from a different lens. And we chatted about this before we hit the go button. One of the cool things about you and the work is that the legacy is so important. And when you do get through to a couple, no different than a dentist that's listening to this, is like, you're not going to save them all, but when you do help a patient or you help a client and they make it through. So let's talk about success. Let's say, think back, we don't need to use their names, but like some of your favorite clients that you've helped get patients out of purgatory. What have they done? Like, what did they do? Did they get back to the basics? Did they start putting time in? Did they think better? Like, obviously they had you in their office, but like, what happened? What did they do?
Yeah.
Go ahead. So when you see that, like, what are some favorite stories as people have helped patients out of purgatory?
Okay, so one of the things that they do, one of the first things that we help them do is sit down and based on, we utilize the AAP standards, right? And their definition of health versus disease and their staging and grading periodontal classification system. Sit down with that and develop a really clear written standard of care. So this is, everybody's collaborating, right, as a team. This is, when we see this, we're going to recommend this. These are the diagnostics that we're going to do. This is the interval, the frequency we're going to do those. Just get everybody on the same page with your standards from a diagnostic and a treatment standpoint. That's number 1. And then they figure out, okay, how are we going to now introduce this to patients that we've been seeing for a long time? It's typically easy with new patients. You know, right. You don't have that relationship with them. if you see something, you can bring it up and you can recommend treatment. But it's those patients that we've been seeing and we know, hey, their spouse just went through cancer and they're recovering, but they've been going through all of this. It's like, I don't want to tell them this now, but what if the spouse has a history of cancer? What if they have a history of, they've had a stent put in an artery and they have diabetes? Like, you don't want them to have a heart attack. So we should be proactive with their health instead of kind of holding things back. So that's a shifting the mindset of we can't tell patients this to how can we? We can't not tell them that they have active disease, and really developing that why. And then I would say just really supporting each other in, holding each other accountable to the standards of care, and really looking at those obstacles and how to overcome those. So everything revolves around that standard of care. And we actually have a standard of care worksheet on our website that is free, that anybody can download. So I know you'll put a link, but if you go to inspiredhygiene.com and you go to our resource guide tab, there's a drop down. There are a whole bunch of free things there. Is get that standard of care, print that out, and start there with your team. And then if you love our help, we have tons of different resources from, a DIY, Perio Protocol boot camp to virtual coaching to in your office, calibrating your team clinically. And we'd love to help you with any of that.
Yeah, you got to check it out. So if you're not taking notes, you didn't hear that, don't worry. You can go down to the show notes and click right on it, check it out. And then you got to check out what Rachel's doing. Just see anything she's doing. I promise you, you'll absolutely love it. So give us some final thoughts on, Perio Purgatory, and help us think better about it before we wrap up.
Yeah. So, it's interesting how we even see this in what you would think as high performing practices. So we do still, from time to time, see people with a single digit perio protocol. Perio percentage. So, I know a lot of your clients used analytics, and you're doing detailed, assessments of their practice. And one of the things we look at is that perio protocol, and the benchmark is at least 35% perio percentage. And, sometimes they'll be at 6, they'll be at 8, and there's just nothing but opportunity there. And then we have a lot of practices that come in and they're already at 20%, or they might be at 30%, but they just have this inkling because they've worked on it in the past. And they say, I just have this inkling that there's somewhere that we can improve on this. And there always is. I mean, I recently worked with a periodontal practice, and even in their hygiene department, they had some patients that had gone through active therapy, and then had just kind of gotten stuck in periodontal maintenance purgatory. So they needed to really set their thresholds for when do these patients need retreatment? When do they need to go back through non-surgical therapy or surgical therapy? And so even in those practices that have a very high perio awareness, they can develop that kind of blindness to how their patients are presenting. But just seeing them talk about how their patients are healthy and now they're not bleeding, right? They get into the doctor's chair and they can easily do a crown prep and the patients aren't bleeding. Patients are coming back feeling better. I remember I had a patient who had lupus, and after we did periodontal therapy, she said, I don't know if this is related, but I've been able to go off of all my pain medication.
That's awesome.
So it's all inflammatory, there. And so you have to look at those anecdotal examples as well, and know that when you address this, it's making a difference. It's making a difference for your team, because hygienists actually have the time to do what needs to be done and not trying to cram it all into a prophy. And it makes a difference for the patients too.
Yeah, I love it. And what you're doing is you're helping people not just fix teeth, but change entire lives.
Exactly.
And this inflammation thing ain't going away anytime soon, don't you think?
Yeah.
It's probably one of the 2 or 3 biggest disruptions we've ever seen, don't you think?
Yeah. The increased inflammation in Americans for sure is just it's unbelievable. And in my observation, one of the big problems is not getting to the root cause. And so if we can help our patients get to even one of the root causes of the problems that they're having, we can make a big impact.
I love it. Thank you so much. That was so good, Rachel.
My
I have like
pleasure.
10 more questions, but like, I know you have other things to do today. One last time, if somebody's listening, where do I go? Where do I find out? What's your website?
Yeah, just go to inspiredhygiene.com if you'd like to learn more about how we can help your practice. Book a discovery meeting. You'll see a link there. And just check out our resource guides.
That's awesome. You're the best. Well, stick around while we say goodbye to everybody. I can't even talk like everybody else. But thank you guys for listening to the Best Practices Show podcast. I hope you enjoyed that today. You're just going to find dentistry is just full of incredibly noble, awesome people that are so willing to help. And Rachel is just absolutely one of them. So make sure you check that out. And I'm going to have her back again and again and again. We're going to try to stump her with perio problems and things that, I don't know, like this is fun stuff for us to figure out. So keep tuning in while we keep bringing great solutions. So until we see you guys next time, or you hear from us next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.